Thank you for the privilege of the podium. For this project, we have no disclosures. Today, the Roux-en-Y gastric bypass is a mainstay of weight loss surgery, but there's considerable variability in technique in getting from point A to point B. Our goal was to investigate these different techniques and their associations with adverse outcomes. This was a retrospective, single-institution study including our 3 NYU campuses, including NYU Langone-Tisch, Brooklyn, and Long Island. Data from 2017 to 2021 were collected by each bariatric center via direct chart review and submitted to the MBSA-QUIP registry. We included a total of 10 surgeons and 711 patients who underwent Roux-en-Y gastric bypass. Adverse outcomes within a 30-day follow-up were recorded, and these included mortality, readmission, reoperation, and morbidity. Morbidity included bleeding, surgical site infection, post-operative pneumonia, severe post-operative nausea and vomiting, DVT, and pulmonary embolism. We surveyed all 10 practicing bariatric surgeons regarding the following techniques in Roux-en-Y gastric bypass. We studied a total of 11 techniques using a univariate regression model to analyze total adverse outcomes, as well as subcategories of bleeding, surgical site infection, readmission, and reoperation. Here we highlight the significant findings from our analysis of total adverse outcomes. The robotic approach was significantly associated with higher adverse outcomes compared to laparoscopic. This could be attributed to the robotic learning curve, as some surgeons adopted the robotic surgery as recently as 2020. Compared to performing the GJ first, performing the JJ first was associated with lower adverse outcomes, as was dividing the mesentery. Sewing the common enterotomy and unidirectional JJ were also associated with lower adverse outcomes. But the bottom line was that there was no significant differences between techniques regarding reoperation, surgical site infection, or mortality. Our study had a few limitations. We could not determine causality based on the nature of our research, and our sample size was smaller, being from one institution. In our regression model, we assumed each technique was independent from each other. And lastly, we couldn't separate the surgeon from the technique itself. However, our findings suggest that Roux-en-Y gastric bypass can be performed safely and effectively in multiple different ways. Thank you for your time.